Spinal stenosis involves a narrowing of the canal behind the disc where the nerves are. Spinal stenosis is caused either from injury, it can be caused by degeneration from overuse, it can also be hereditary. The first treatment for spinal stenosis is physical therapy or chiropractic care. Now, that should always be our first option to treat this in the most conservative manner possible. Sometimes patients don't respond to physical therapy or chiropractic care, and in those patients we often recommend steroid injections to try to decrease the inflammation and hopefully alleviate the pain. There is, unfortunately though, a small subset of patients that don't respond to conservative management and will require surgery to treat the spinal stenosis. Spinal stenosis that is treated surgically can be treated through a multitude of different procedures depending on the degree of stenosis and how severe it is. The simplest procedure is something called a foraminotomy or laminectomy, where the entire procedure involves removing the stenosis and tissue that's directly impinging on the nerve and thereby alleviating the pain. In some cases, though, the stenosis is so severe that we have to do something called a spinal fusion. In other words, we have to remove the material that's compressing on the nerves, but then also support the spine so that you don't have any weakness. Here at the practice, we have treated thousands of patients with spinal stenosis successfully with both conservative treatment as well as with surgical intervention. If you have any questions about spinal stenosis or think that you may be suffering from spinal stenosis, please don't hesitate to reach out to our office.